Environmental factors. The major and most common environmental factors leading to depression include 1. Major life events. Continuing and growing difficulties, long-term unemployment, living in an uncaring or faulty relationship, long-term isolation or loneliness, prolonged work stress, are more likely to cause depression than recent life stresses. Many researchers also suggest that sometimes even good events such as starting a new job, graduating, or getting married can lead to depression. Other traumatic or stressful events, such as a difficult relationship, or financial problems also leads to depression in certain cases. 2. Abuse. Past physical, sexual, or emotional abuse can increase the vulnerability to clinical depression later in life. Even child abuse underpins adult depression. In almost every case of significant adult depression, some form of abuse was experienced in childhood, either physical, sexual, emotional or, often, a combination. 3. Medication. Medications such as barbiturates, benzodiazepines, and the acne drug isotretinoin, formerly sold as Accutane, now Absorbica, Amnesteem, Clarivis, Myorsan, Xenatane, have sometimes been associated with depression, especially in older people. Likewise, medications such as corticosteroids, opioids, codeine, morphine, and anticholinergics took to relieve stomach cramping can sometimes cause changes and fluctuations in mood. 4. Death or loss. Sadness or grief from the death or loss of a loved one, though natural, may increase the risk of depression. This happens generally when a person is unable to accept the death or loss of his loved one, or when the sudden tragic death of the individual leaves you alone, with nobody around to share the sorrow or grief. 5. Age. Teenagers and old-aged people more often fall prey to depression when compared to the other age groups. However, depression is a common problem in older adults. It impacts older people differently than younger people. In particular to the elderly, depression is a side product of other medical illnesses and disabilities and lasts longer. 6. A past head injury. Research has found that patients with TBI, traumatic brain injury, are more likely to experience depression than those who have not had a brain injury. People who experience serious head injuries often require days, if not weeks, of medical care to get back on their feet. For most of them, the mental aftershocks will last long after they've checked out of the hospital. According to a study, more than half of all people who suffer a traumatic brain injury will become depressed in the year after the injury, a rate 8 times higher than in the general population. The reason is that the brain injuries themselves may cause changes in brain structure and function that predispose people to depression. 7. Having a past episode of major depression. Having had one episode of major depression in the past increases the risk of a subsequent one. About half of the people who experience an episode of depression for the first time will remain well. For the other half, depression can return one or more times throughout their lives. It is most likely to return within 3 years after a first episode but varies from person to person.